Hi, my name is Kale Evans. I'm a student nurse at Wilson State College, and today I'll be performing a skills video, which is a clean catch of urinalysis, as well as inserting an indwelling catheter, irrigating that catheter, as well as removing that catheter. So to begin, I'm just going to go over my provider order. I have Shirley Coast, of 54-year-old female with the date of birth of 5/14/1964, and Dr. Leo has ordered for a clean catch urinalysis. So just to do that, I'm just going to make sure I have everything I need. I'm going to have a clean specimen cup that's sterile, that's never been used. It's going to have a seal on it. I'm going to need a biohazard bag, and then I'm also going to be needing a label with Shirley's name on it. So it does have her name, her date of birth, 5/14/64, Shirley Coast. Okay, so this all matches. I can then enter the patient's room. I can knock. I can introduce myself. Hi Shirley, my name's Kale Evans. I'm going to be your nurse today. I'm just going to match my provider order to her wristband and also get her to verbalize her name and date of birth to me. So, what's your name? Okay, Shirley Coast. Okay, 5/14/64. That matches her wristband, as well as she's allergic to codeine. That doesn't matter to me today, but it does match here on the provider order because we're not going to be doing anything with codeine. So I'm just going to explain what we're going to be doing. So I'm just going to need you to go pee into this cup, into the bathroom for me. I'm going to give you some cleaning wipes. You're just going to clean in one motion each side of your external meatus and then your urethral meatus. So one wipe per swipe. And then I'll have you void, spread your labia, begin your void, and then since my patient has great sphincter control, she's going to be able to quit voiding, put the cup underneath of her, void into the cup for at least 10 mils, and then she's going to be able to quit voiding again, set the cup off to the side, and then empty your bladder, and then once she's done in there, she'll clean up, she'll come out, she'll make sure the cap's on for me. I'll go in with some gloves on. So with my gloves on, then I can make sure that the cup is fully secured shut. So I'll make sure it's shut. I'll apply my label onto it that has her information. I'm going to initial it, date it, and put the time in. And then I'll place it into the biohazard bag. And I can designate a CNA to either take it to lab or I can take it to the lab myself. If they're not ready for it, I can go into a fridge for further testing later on in the day. So once I've delivered that, I would discard my gloves, perform hand hygiene, go back to the nurse station chart, what the color was, how everything looked, how the patient tolerated it, and then I can move on to my next order from the provider, which is inserting an indwelling catheter. So with that, I'm just going to be able to get my supplies here. Okay, and so with my supplies ready, I'm going to be able to go into the patient's room, knock, introduce myself. Hi Shirley, it's me again, Kale, I'm your nurse. I'm just going to make you verify your name and date of birth with me. So she told me your name's Shirley, date of birth 5/14/64, and I can match it here on her wristband, as well as codeine as an allergy. That matches here, but we're not doing anything with codeine, so we're fine there. So I'm just going to explain to her what we're doing. So Shirley, we're going to be putting in a catheter into you today. We know that you've been having trouble voiding, so we just want, after surgery, so we just want to see if that'll help. Have you ever had one before? Yeah? Okay, perfect. So you know what you're expecting, so once the patient fully understands what we're going to be doing, I can then go on to performing the procedure. So I'm just going to pull the blankets back. I would cover the patient with a bath blanket in the diamond form, but for her modesty, but with this video, for video purposes, I'm not going to be doing that. So I'm just going to put some gloves on so that I can clean her. So I put down a chuck, which is already down in here. So I just put down a blue chuck for the procedure purposes. I have warm soapy water in here, and I just wrap it up and perform peri-care on the external meatus down, rotating, get new water, external meatus down, new water, and then going down through urethral meatus down. Okay, so that's done. I can get rid of this. I can get rid of my gloves, and then we can start putting in the catheter. So, with the catheter, I'm just going to make sure I got a 14 French here, so that's a good size for the patient. So, and it's never been opened, it's sterile, it's hasn't expired, and then I also have here sterile gloves that will fit my hands because the ones that in the package don't. So I'm just going to be able to open the package up and dump it out. And then I'm just going to roll this back just to make like a little garbage can that I can then use while I'm performing the procedure. Perform hand hygiene, and then I'll begin opening this sterile field. So the first thing you want to do is open it away from you. You can grab the outer 1 inch because that's considered non-sterile. And then you want to do the sides again, just grabbing the outside 1 inch, making sure it's not going to contaminate. And then, so once I have this all the way open, I can then put on the gloves that will fit me. I'm just going to square this up here, which I can do because I'm still grabbing that outside 1 inch. And so these gloves, just going to open up. Like this, and just pull these out and get rid of this, and then these will just open just like this, making sure to keep them sterile. I don't want to touch them with my hands, just touching the outsides when necessary. Okay, and so with these ready, I'm going to start with my dominant hand, which is my right hand. I'm just going to grab this part out here, which is going to go on the inside, so it doesn't matter that I touch it with my hand. I'm just going to get my fingers in here, just like this. Okay, and then since I'm not touching the outside here, I'm just going to roll it down and just release. Okay, and so since that's on, this is sterile, so I'm just going to grab the sterile side of this glove on the inside here, and then just going to insert my hand on this non-sterile side. Making sure to get my fingers in all the fingertips, and then just pull it over. Okay, and then since this is all sterile, I can fix it accordingly. And then just pull it down, and we're ready to go. So this top part, these are the gloves that were already in here that don't fit me, so I can get rid of these. Since this is sterile, I can handle them properly, and I'm just going to toss them into that garbage. And then right here is that it is a waterproof lining. I'm going to use this. I'm going to make sure that I don't touch anything that's not sterile down here. So I'm just going to lay it down here, not touching anything, and then just kind of push around. See, this is just still sterile. Okay. And then this one I'm not going to use either, so this can go into the garbage as well. And so, I got this already here. Just going to turn it. So these are the swab sticks that I'm going to be using to clean. I'm just going to prep my field here. I'm going to open up this lube, put it into the tray, and then I can discard of it. And then I'll have my hose ready here. Grab that out. I can toss that. And then with this, I'll just set it aside, and I'm just going to prep my catheter here before I go and clean or anything. So I'm just going to discard of that, make sure that it stays in the sterile field. Toss that. Then I'm just going to prep this and plug it in. Okay, so that's all ready. Okay. So then I'm just going to go ahead and excuse me, and clean Shirley with these 3 sterile swabs. So this first swab is just going to go the external meatus and down and around. Okay, and then that will go in the garbage. The next one will go on the side towards me, down and around. And then this last one will go straight down on the urethral meatus. Straight down, rotating, and then that will go in the garbage as well as this. Okay, and so since we're ready, I can move this over to the sterile field. And I'm just going to talk the patient through what's going to be going on. I'm just going to open the labia with my 2 fingers. They'll become unsterile, and then I'll be inserting the catheter. I'll have her breathe through a straw, not literally, just act like she's breathing through a straw. And then I'll just have this wound up, ready to go. I'll have my assistant here, just spray it with some lube. Okay? Okay, so when the patient's ready, I'm just going to count to 3. I'm just going to have it spread open, and once she starts breathing, okay, 1, 2, 3, I'm just going to insert it. For women, it's going to go in 2 to 4 inches, or 2 to 3, and then once I see urine coming through, then I know I'm in the right spot. So then I can insert an extra 1 to 2. And then for males, it would be 7 to 9 inches, and then the 1 to 2 as well. So then once I get that in, I'm gonna hold it and secure it with this hand, and then I will push this 10 mils of fluid in so that the balloon fills up, so that it won't come out. Okay. And then I can disconnect it. And I'm going to be needing this when I remove the catheter, so I'll be keeping it, but in a clinical setting I would discard of it. And then I have a piece of tape here to secure this to Shirley's leg, as well as this going to the patient's gown. And then I would clean the patient of any of the Benadine just to make sure she's clean. And then I will drape this down over, making sure it's lower than the bladder. And I would note any immediate fluids that we would get out of there. And I'd chart them, make sure to write down the color, consistency, how the patient tolerated the procedure. I clean up my workstation, make sure it's not messy for the patient in the patient's room. Get rid of all this garbage. Gloves on. And I'd make sure that the patient's laying comfortable. They don't need anything from me. I'd make sure that I'd cover them up for modesty, and I'd leave and I'd go in and chart. And then so it's been some time now. We have an order for the patient to get the catheter irrigated. So for that, I'm just going to need couple things here. I'm going to need this 0.9 solution of saline, a Lure Lock 30 ml syringe, which is sterile and hasn't been opened, as well, same thing for this irrigation tray and bolt syringe. It's hasn't been opened, it's sterile. I'll also need these clamps and this needle for the syringe. And so with all these, I can knock to the patient's room. I can introduce myself again. Hi, it's me. Oh, excuse me. It's me again. I'm Cal, your nurse. I'd get the 2 forms of identification and have them verbalize it to me. So Shirley Coast, 54 female, 5/14/1964 on the wristband, as well as codeine as an allergy. And we're still not doing anything with that. So I just make sure to put on some gloves first after performing hand hygiene. And then I'm just gonna move this over here. Before I irrigate the catheter, I'd want to empty the bag of any fluids so that I can get an accurate measurement after I irrigate it. And then I just make sure to talk the patient through it. So I tell the patient we haven't gotten any good return out since we've inserted the catheter. We're just going to irrigate it with 30 mils of solution. It's room temp. It's not, it might seem a little cold, but it's a temperature to where it won't make any problems. It won't have any complications. Just make sure that they understand it's just going to go in, go through a cycle and come out. And once they understand that, we can proceed with the procedure. So I'm just going to pull this open. It's sterile, so I have clean gloves on. I'm just going to get this out. I don't need this bowl syringe, so I can put that back. And then I'm just going to fill this up with 30 mils of fluid of the sterile sterile sodium chloride. And then I will also pull this syringe, and then I'll insert it in here. Since they're both sterile, it's fine that they go in. And then I'll just pull up the 30 mils of fluid. Just right there's 30 mils. So before I do anything with this, I want to make sure that I have the patient still covered for modesty, but I'm going to want to clamp underneath the port here so that all this fluid in here goes up into the bladder. So I'm just going to clamp here, make sure that that's sitting just right. And then I'm going to disinfect the port with an alcohol swab, just standard 15 to 30 seconds. And then I can then cap my syringe here. Okay, so I'll just pull that off, and we'll just go like this, in, and then we'll just go and push the fluids. Okay, once the fluids are pushed, I can bring the needle out using the scoop technique. Then grab the base, make sure it's on, unscrew it, and put it into my sharps. And then this stuff is, I'm done using it, I don't need it anymore, so then I can just discard of it. This is all garbage. And then I can, if it was a solution that was ordered to stay in the patient's bladder, I would keep this clamp, but since it's not, it's just supposed to run a quick cycle. I can then unclamp the tube and wait for the return. I would note any coloration to it, any consistency, if it was bloody, if it was mucousy, and then I would also measure the amount. Before I'd leave the patient's room, I would go and empty the bag, and I would go and make sure to write or chart any of my findings. So And then I would take my gloves off, perform hand hygiene, and go on to my last part here in the nurse station, which is discontinuing the indwelling catheter. So before I go, I'm just going to make sure to perform hand hygiene and just go into the patient's room. Introduce myself for the last time today. Just make sure, hi, I'm Caleb, your nurse. We're going to be taking that catheter out of you today. Just got to make sure you can confirm your name and date of birth. So Shirley Coast 54, female, 5/14/1964. And that matches here on my doctor's orders or my provider orders. So that's all good. So I'm just going to get my syringe out again. Some gloves. And so before I pull the catheter out, I'd make a note of the bag, and if there's any fluid in it, I'd write it down, put it on the output as I would have done every time that I've emptied the bag throughout the day. I would have put it on the output sheet. So I'd empty it, and then I would then have the patient covered for modesty, but then I'd uncover them, and I would make sure that they understood the procedure that we're going to be doing. I would unhook all of these. I'd make sure that they're not taped down. Okay. And then I'm just going to insert this syringe here. And I'm just going to pull out that 10 mils of fluid that's in that bulb. When I inserted the catheter, I would have also charted the amount of fluid that I put into the bulb, so that if I weren't the one to take it out, that the nurse, whoever was taking it out, would be able to see that in the patient's chart on how much return they would get. So I got the full 10 mils. I can disconnect this and put this into the biohazard bin. And then I would talk the patient through the removal process. So I'd just make sure that they're ready for it. Just take breathing like they're going through a straw again. And then on the count of 3, I'm just gonna pull, slightly twisting. So ready, 1, 2, 3. And then I just bind this up in the chuck that I had prepared underneath the patient. And I disconnect it from their bed. And I'd throw this into the biohazard as well. I'd clean the patient with just regular old Pericare if it was needed, so again, warm soapy water with new gloves. Then I just do the old, just out and around the external meatus, new water, external meatus, new water, and then down the urethral meatus. New water, pat to dry. I'd make sure that the patient is feeling good, they tolerated it. If there's any complications, I'd make sure to note of it. I'd make sure that the patient is sitting well, resting comfortably. I'd get rid of my gloves, perform hand hygiene, chart my findings, and that's the end of my skills video.